Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Tuesday, November 10th. We are joined today by the Minister of Education, the Honourable Tracy-Anne McPhee, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. As usual, we have with us our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate to provide translation. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@gov.yk.ca. Minister McPhee?
Thank you very much, Mary. Pat, thanks so much. Thank you, everyone, for joining us today. I'm pleased to be here with Dr. Hanley on the traditional territory of the Kwanlundan First Nation and the Ta'an Kwachan Council. Our government continues to manage the impacts of COVID-19 and the pandemic based on Dr. Hanley's recommendations and guidelines. We are fortunate here in the Yukon. Thanks to the efforts of all students, families, educators, school staff, and community members to stay vigilant and to follow the Safe 6, our communities have kept the spread of COVID-19 to a minimum. This has allowed us to keep our schools open and continue face-to-face learning for all students, keeping our classrooms as normal as possible for the vast majority of our students. As I'm sure you know, many jurisdictions across Canada continue to face significant challenges due to COVID-19. We have had to grapple with significant adjustments to the way that we provide learning for ours. They have had to provide significant adjustments for how they provide learning to their students, and some schools have even had to close. Since the start of the school year, we have been continually monitoring and assessing the changes that we have had to make to meet the health and safety guidelines for Yukon schools. Central administration is working with school administration to ensure we understand the impact of this school year and any concerns are being addressed. The Office of the Chief Medical Officer of Health has also been monitoring activities here and across the country and continue to provide our government with advice. Dr. Hanley and his team have been working to update the health and safety guidelines for Yukon schools, and he will share more details about that in a moment. As we approach the middle of the first semester and look ahead to the second semester, I want to provide some updates on our decisions and continued work for the remainder of the school year. Together with school administrators at FH Collins, Porter Creek, and Vanier Catholic Secondary Schools, and with support from the Office of the Yukon Chief Medical Officer of Health, Central administration staff have been exploring options for returning grades 10 to 12 students to full-time face-to-face classes while following the health and safety guidelines. This is truly complex work and has required assessment of many different factors, including spacing and facility needs, additional staff needs, impacts on school busing, and maximizing course options for students. Through this process, it has become clear that under the current health and safety guidelines, we do not have the adequate spacing or staff resources to accommodate a full-time return to class for grades 10 to 12 students here in Whitehorse. To accomplish all grades 10 to 12 students in class full-time under the current health and safety guidelines would require multiple off-site locations or at least 3 satellite-style high schools. We know, based on the resources and the staffing needs at other smaller high schools in Yukon, that this is simply not feasible. For example, Watson Lake Secondary School, one of our smaller rural schools, requires approximately 15 school staff to support their 80 students. If we were to establish several satellite high schools for grades 10 to 12 students in Whitehorse, we would be looking at accommodating up to 900 students and between 35 and 60 additional staff to support them. The additional qualified staff to return these students to full-time under the current health and safety guidelines are simply not available. This is the reality across the country. And I want to be clear, it is not that we don't have the funding for dozens of additional staff. The staff are just not available. In addition to a lack of educators for additional high schools, we would need to use off-site locations that may not fit the needs of an effective learning environment. We would also need to reduce course options, including eliminating elective courses for these students. This would not be in the best interests of our students. And as a result of these considerations, we have determined that grades 10 to 12 students will remain on their current schedule for the remainder of the school year, with additional supports to ensure all students are successful with the blended learning instruction models. The health and safety of our students and our staff and our communities must remain the first consideration in every decision we make this school year. We have seen across the country that COVID-19 virus is not going away. And we need to remain vigilant in following the advice and recommendations of our public health officials. Our current programming is the best way to ensure that we can provide course options and individualized timetables to prepare our high school students for their unique future education and career paths. While 10 to 12 students are only in the class part-time, they remain on a full-time learning program. We know that this is working for some students and that it is very challenging for others. We are committed to providing additional resources to ensure those who need support in their learning receive it. We will be working with school administration at these 3 high schools, Yukon First Nations, school councils, and the Yukon Teachers Association to hear their feedback on additional supports that are needed. We will also be launching our second Learning During COVID-19 survey later this month. It will help ensure we hear feedback from students, families, and school staff on the supports that they need to be successful on this learning schedule. Examples of supports that we will invest in to support these students include additional staffing to support student needs, supports for teaching successful work and study skills for students, success coaching, more in-class time for students identified as needing additional supports, tutoring options, increased online tools and supports, and increased capacities at study halls to accommodate additional students for longer periods. The supports we invest in will be determined by school administration and staff based on the needs of their students and the feedback that we are hearing from their families. To date, we have invested or committed over $3 million in federal funding to provide additional supports for students, support continued learning and flexible learning, and for increased health and safety measures like extra custodians and sanitization. We look forward to continuing this work and providing updates as we identify these additional supports for our grade 10 to 12 students this school year. As part of our continued assessment of our programs, we have been working to support the music, art, and drama program for the remainder of the 2021 school year. While we have had to make adjustments, we are very pleased that the MAD and other experiential learning programs have continued this year. We recognize the value and the outcomes of the MAD program and the immersive experiential learning that these kinds of programs offer our Yukon students. We have now had time to better determine how the grade 8 students are using the space for learning at the Wood Street Centre. We have worked together with school administration from F.H. Collins Secondary and the Wood Street Centre and the Chief Medical Officer of Health to determine that the MAD program can move back to the Black Box Theatre at Wood Street Centre as soon as possible and for the remainder of the school year. School administration and staff will be sharing these updates and more information with parents and students of the program about the timing of this move in the coming days. This move will not affect the current location for the F.H. Collins grade 8 students. They will and can continue to learn in the classroom spaces at that school. F.H. Collins administration will be working with their grade 8 staff to ensure ongoing success to space for their fine arts and the physical education programming for grade 8s. Central administration staff are currently working with school administration at these schools to operationalize this decision and ensure that we continue to follow the health and safety guidelines set by Yukon's Chief Medical Officer of Health. We have now been provided the program plan for the semester for the MAD program, and we understand that that program intends to hold a final show. If needed, we will work with the MAD program to find a larger space to put on this final show. School administration will provide further updates to their school community on the operational plan to ensure that students and families are aware of any impacts to their current schedules. The last thing I would like to touch on is busing. Our school bus system has also been impacted by the realities of this pandemic. We've had to make adjustments to ensure that students can be bused to school and home in accordance with the health and safety guidelines provided by Yukon's Chief Medical Officer of Health. To date, we are busing up to 1,900 students. However, the pandemic has reduced the capacity of our school buses and led to some challenges for families in and around Whitehorse. I'm pleased to share that the 3 additional school buses that we have ordered have arrived in the territory. The buses are being inspected to ensure that they are safe to operate. Additional bus drivers have been hired and trained so that as soon as the buses are certified for use, we can get them on the road to help pick up Yukon students. We will work to ensure that these additional 3 buses are used for the maximum benefit of Yukon students. We continue to work with families to address their busing concerns, and we look forward to the increased capacity that these buses will bring to our system. Thank you very much, everyone, for your attention today, and I'm looking forward to answering your questions.
Dr. Hanley?
Merci, thank you, Minister McPhee. Good morning. Bonjour tout le monde. Before continuing on the education theme, a brief review of our case counts, and I'm pleased to report that we have not had any new cases since our last confirmed case on October 29th. And as of today, we have only 1 active case, with 21 having recovered. As Minister McPhee indicates, we have been working side by side with the Department of Education since the early summer to ensure that our kids make it through this pandemic while preserving their mental health, their physical health, and their learning potential as intact as they can achieve. I understand the stresses of being a parent and the anxiety that many of us faced as our children returned to school. It has been a difficult transition over the past several months, but just as Yukon is in a good place right now, so are our schools. There's still lots of the school year to go, but to date, we have seen no cases in any schools in Yukon and no cases that have been linked to schools or school staff. That's not surprising, as the experience of other jurisdictions is that cases in schools are closely connected to the number of COVID cases in the community. I'm confident that as long as we remain successful in keeping Yukon cases to a minimum, likewise, we will be able to keep COVID numbers in the schools to a minimum. But success to date does not mean that we can relax. We're still facing many challenges related to the pandemic. As Minister McPhee spoke to, our kids have been going through constant changes this school year, and staff and school children alike have been adeptly adjusting to the present version of normal. As you know, in order to meet health and safety requirements and to reduce our overall risk of COVID exposure, students in grades 10 to 12 were switched to a different learning schedule that minimized the number of students in the hallways, classrooms, and common areas. As in all aspects of the pandemic response, we have had to find that middle way where we protect our students and staff from COVID risk, while ensuring that their ability to thrive in a learning environment was supported as much as possible. We have had to take extra precautions due to the pandemic, which has meant flexible learning to reduce traffic flow in schools, to limit interactions between students, between staff members, and between students and staff. These changes have left a lot of parents and children and teachers wondering when things will go back to normal. With the pandemic continuing as a threat, especially as cases increase across the country, we must remain vigilant with our precautions. We have seen here, even recently, how easily COVID can swoop into our lives. To keep our schools open, we must continue a COVID-adapted, different approach to learning. As we move further into the school year, we are in the process of updating the health and safety guidelines for all K-12 students. These newly updated guidelines include changes to physical distancing recommendations within the classroom, as well as adding clarity to the use of masks in areas outside of the classroom where physical distancing is more difficult to maintain. The requirement of physical distancing will be changing to 1 meter within the classroom between students. And masks will be not just recommended, but required in common areas. These areas include hallways, cafeterias, libraries and corridors, among other common spaces shared in schools. The Department of Education continues to keep a close eye on the changes and how students are adjusting. And that upcoming learning survey will be so important to inform how students and staff and parents are all coping. The priority is still providing the students and teachers with the resources they need to succeed and to do so safely. I understand the concerns that parents have been voicing. I hear them not just as CMOH, but also as a parent that wants the best learning environment and outcomes for my own children. Right now, we need to keep reminding ourselves that our focus is centered on maintaining the health and safety of students, teachers, and the broader community. With the right supports, our kids can accomplish great things when faced with new circumstances and even new opportunities, just as we are seeing in these extraordinary times. Even so, we have to recognize that our children are experiencing these new ways of learning very differently. Clearly, many children are adapting well and even finding new rhythms they have never found before. But others are struggling more with the flexible learning schedule. If that sounds familiar to you, I hope you will be able to access the various pillars of support just identified by Minister McPhee that can or will help those who may be finding this transition difficult. In this pandemic, it's hard to predict the future. The next few months could change, and we may need to adjust once again. But we have been working closely with the Department of Education to ensure that all students and teachers are given the support they need as we continue to navigate these unfamiliar waters. On Saturday, Dr. Bonnie Henry addressed BC residents with newly imposed restrictions to slow the increase of COVID-19 cases in BC, particularly in the Lower Mainland. The new orders were put in place to combat the recent accelerated growth of cases in this area. All residents living in the two affected health authorities, Vancouver Coastal and Fraser Health regions, must abide by the following. They are not to socialize with anyone outside of the immediate household, and this overrides the previous recommendation to stick to a small social group, known in BC as the Safe Six, and not to be confused with our own Safe Six guidelines. Outdoor gatherings and gatherings in restaurants are no longer permitted. Weddings and funerals may only be attended by the immediate household present. Travel to and from the affected regions or within these two health authorities is highly discouraged unless essential. And these areas include well-known and popular areas to visit for Yukoners, such as the city of Vancouver, Richmond, Burnaby, White Rock, Surrey, and others. So what does this mean for Yukoners? BC is clearly attempting to slow the spread of COVID-19, specifically within the areas highly affected in these Metro Vancouver locations. Since we remain for the time being bubbled with BC, these newly imposed restrictions will affect us to some extent. For those traveling, you must be aware and ready to follow the newly implemented guidelines. When in BC, you must consider and abide by all necessary gathering guidelines. This also applies to weddings and funerals. If you are planning to attend a gathering, a wedding, or a funeral in BC, I ask that you rethink your visit. Attendees at weddings and funerals are now limited to immediate households. Ask yourself if the gathering will be still able to go forward with the new restrictions. Are you able to attend virtually, or will the gathering be rescheduled? More than ever, we need to be as safe as possible. This may mean delaying a trip or making other arrangements. Although we are in a bubble with BC, we have to recognize that the risk of exposure to COVID while traveling to the Lower Mainland is higher than it was during the summer months. While the interior and the island remain relatively unaffected, traveling to the Vancouver area will require extra caution. The restrictions I just mentioned are currently in place for 2 weeks. This timeline could be extended. With the holidays upcoming, these new restrictions may need to be reviewed before any travel occurs. For people returning or coming back to Yukon, you need to take preliminary precautions. Before returning back to Yukon, it's critical to take deliberate steps to reduce your risk of exposure to COVID before your travel date. This is accomplished by closely abiding by current provincial guidelines wherever you are. In particular, rehearse and practice the Safe Six. Physical distance when in a public, and in addition, wear a mask wherever recommended or required. Practice proper hand hygiene, avoid social gatherings, and stay home and away from others if you're feeling ill. If you are coming back to Yukon from BC, particularly from the more affected areas in the Lower Mainland, lay low, monitor yourself for symptoms. Practice vigilant physical distancing, wear a mask in public, and be sure to self-isolate and get tested for any symptoms at all that match the assessment criteria. Wherever you have been outside Yukon, if you are informed by anyone that you may have been in contact with someone with COVID, please call Yukon Communicable Disease Control or your community health centre if you're in rural Yukon. With all our advice about travel to and from BC, we remain overall in a good position. With only one active case in Yukon, our public health capacity remains robust, our healthcare capacity is ready. I sense that people, by and large, are doing the right thing to maintain COVID precautions. Thus, at this time, we will not be changing our bubble with BC, but I assure you we will continue to monitor closely. Again, we can't predict what will come over these next few weeks. You must keep up to date on BC updates before any travel or hosting any visitors. This is a time to remain alert and vigilant. But as long as we take the necessary measures to reduce our exposure, we will be in the right place. Well, holiday lights are being hung and decorations are coming out and the holiday hustle and bustle is beginning. It's certainly a time that's joyous for many of us. And as we begin setting up decorations in houses and buying presents from the local shops, we need to discuss what this holiday season will look like. When the pandemic first began, we remained hopeful that things could return to a place where we would be able to celebrate in a fashion that had few COVID-dependent guidelines in place. However, we all now surely realize that the holiday season will not be as usual. This doesn't mean the holidays are cancelled, but instead we have to get creative. With Thanksgiving and Halloween, Yukoners rose to the occasion. We hosted gatherings outdoors around a crackling fire, raised glasses in a cheer via Zoom, and handed out sweets from a safe distance. We have proven time and time again how we can adjust and react accordingly. This holiday season will allow us to shine in how we celebrate, with COVID guidelines in place. I know that in normal times, many of us would either be traveling or having loved ones come to us for the holiday season, especially those with children in university or college outside. COVID does not mean they can't come home for the holidays, but in some cases, it is worth considering if this is the right time to travel. For some, it may be better to wait for the next opportunity in spring or summer, where circumstances may be more friendly for travel back and forth. For students who are planning to come home for Christmas, or for Yukoners who are hosting family from outside of the territory, I ask that you be cautious and abide by the following guidelines during this holiday season. If you're coming home from outside Yukon for the holidays, reduce your exposure before traveling. As mentioned a little while ago, follow carefully all provincial guidelines. Avoid social gatherings. Get tested and self-isolate for any COVID-like symptoms that may occur. Avoid unnecessary outings to meet friends or going to restaurants and bars. This will help reduce your overall risk before you get on the plane to come home. Once home, you will need to self-isolate if you're currently residing anywhere outside of British Columbia, Northwest Territories, or Nunavut. Plan your stay around when your family is off from work or school. Once you leave Yukon to return to school, if your family has been self-isolating with you, your family will need to carefully self-monitor for symptoms. When you are traveling, bring hand sanitizer, wear a mask, and maintain distancing measures while waiting for your flight. If you plan to come home for the holidays, remember it's essential to read the COVID guidelines on yukon.ca before coming home. Now, if you're planning to go to BC to meet family from a different province, make sure once you return to Yukon that you self-monitor and again, keep a low and careful profile. Stay home and avoid going to gatherings or highly trafficked public places. Even though you will not be under order to self-isolate, it is crucial that you follow the same general measures as you would have if you had traveled outside of the bubble. Consider yourself as under voluntary self-isolation measures. We all need to be wary of the risks when we are traveling. This is something that as Yukoners we need to take seriously. If we don't, there could be substantial repercussions to our actions. We have seen the country's case count rise steadily upwards. When we travel without due caution, we are increasing the risk to our community. Once back, we need to be aware of the added risk. But for all Yukoners, even with an additional risk of importing cases into Yukon from the surging cases in the rest of the country, we all have a role to play in limiting the effects. We can easily tolerate introduction of COVID cases into Yukon when those cases remain limited to 1 or 2. It is the outbreak scenario, the spread to multiple individuals that gather for a party or in a work setting or for a funeral or a ceremony that we could see a major setback for Yukon. Cases will always have a chance to enter Yukon, but we have control over what happens when a case does come in. That part is up to all of us to manage. And that's all for my update. Thank you. Take care of each other and stay well.
Thank you. We'll now go to the phone lines, and we'll start with Luke from CKRW.
Yes, I have a question for Dr. Hanley. With the news yesterday, I know it's early, but with the news yesterday that there's been significant progress on a COVID-19 vaccine, is there any preliminary plan on how a vaccine would get distributed to Yukoners?
Yeah, thanks for that question. We are planning for many different scenarios right now, including possible delivery of the early vaccines as early as the first quarter of next year. So, but with the Public Health Agency of Canada, with the Canadian Immunization Committee, which is a jurisdiction-wide representative group of vaccine representatives, of which we are a member, and with all of with all of the people that need to be in that decision-making here in Yukon, we are, I would say, quite intensely preparing for various possibilities and really putting those preparations in place. It's too early to say which vaccines will be the most appropriate for our populations. And of course, we don't have the official efficacy data for any of the vaccines. None of them have completed phase 3 trials. But we are putting in place that early planning that would allow us to participate in the vaccines as they become available, and then it really becomes a matter of deciding how much is available, which product, and which is most suitable for our populations. We have a number of very specific considerations, given that we are a very small population and with a large rural contingent. And so all of that factors into our vaccine planning. So really too early to be specific on anything, but definitely a lot of planning is happening right now in the background.
Thank you. John, do you have Luke, do you have a follow-up question?
No, thank you.
Thank you. We'll move to Dave from CBC.
Hi, for Ms. McPhee. First, when you talk about the MAD students going back to Wood Street School, said they go to the theater. So will all their time during the day be spent at the Wood Street School now, or will they still have to kind of go back and forth to another building?
Thanks for the question, Dave. The intention would be that they would spend most of their time at the Wood Street Black Box Theatre location. That will be their main place for programming. But their programming, of course, will be determined by the teachers. And they have been taking some field trips, those kinds of things, as I am aware. And they've been doing some learning outside of their current school location. So that'll be up to them. But they will be, their headquarters will be at the Black Box Theatre in the Wood Street building.
Thank you. Follow-up question, Dave?
Yeah, just one, and thanks for that. And so what led to the department's decision to let the kids move back to that school?
Yeah, it was based on our continual assessment of what was happening with those students and with other experiential programs, and in particular with the grade 8s that are housed currently. The grade 8s from FH Collins, as you might know, are attending that school for their full day learning. And once we could determine how those spaces were best being used, it was determined that the black box space in that Wood Street School was not being used to its full capacity by the grade 8s. So the opportunity for us to explore whether or not the MAD program could return to that space, and in consultation with the Chief Medical Officer of Health and how many students could be in that building and the way the space is being used and students moving around, was determined that that would be a safe option.
Thank you. We'll move now to Claudiane, Radio-Canada.
Yes, for Minister of Education, Tracy-Anne McPhee, just wondering, so you said $3 million had been spent out of the 4.6 provided by the federal government. I was hoping to have a little bit more details as to exactly how that money was spent.
Sure. We have either spent or committed up to about $3 million of that. As of the numbers that I have here are from November the 9th. There's about a little over $703,000 spent on things that we would classify as health and safety, extra custodians, sanitization costs, ventilation costs, sanitization on busing, on school buses, and then health and safety training for school staff, and for health and safety training for teachers on call, or what's known as substitute teachers. We've spent or committed a little over $1.3 million for what's considered continued learning, so adapting the K-12 programming, moving classes or students from one location to another, special services pay for principals and teachers, school staff to support programming adaptations, and additional transportation costs. About $907,000 on additional supports for students as of November 9th. Some funding to student support services. We've focused on trauma-informed instruction. The virtual study hall costs were calculated here. Additional support costs for school staff to support student learning and tutoring. And about just under $100,000 spent on flexible learning, so focus on IT, technology, on curriculum training, whether it's Zoom costs or communications, IT infrastructure costs, and I think that's about the best breakdown I can give you just now. If you have further questions, we can address them.
Thank you. Another question, Claudiane?
Sure, this was pretty detailed. Thank you. How will the extra support that you're proposing for students who are not doing as well in the part-time setting, how will that support be determined, and where or how will you put the funding in place to provide for that extra time, perhaps from teachers?
Thanks for that. The question about individual learning programs, and I guess I want to be really clear. We know that the current 10 to 12 situation is working for some students, but we want to focus on the students for which it is a greater challenge. We will take direction from the administrators and the teachers who are working with those students and those families, and we urge them to come forward so that we can work with them on individual learning plans. Does a student need more time in the school building? Do they need more supports in the study hall portion? Are they not a strong learner with respect to technology and therefore need more in-person instruction. Those kinds of things will need to be worked on an individual basis. The expertise of our students and administrators, of our teachers and administrators, will be where we look to for that guidance. And we are very focused on making sure that the learning experience of those students is as strong and as supportive as it can be. There will not be a pot of funds, for instance, for those kinds of targeted initiatives because they're so individual. We'll be working with the schools and the school councils to determine individually with families and with students how to best support those students.
Thank you. We'll move now to Haley at the Yukon News.
Thank you. I had a question about if there's been any developments on the use of school facilities like gyms for external programs like sports groups and Girl Guides, that kind of thing. Has there been any update on that?
Thank you for the question, and I know we're all awaiting the final version of this. I can say that the Department of Education and the Department of Community Services, as they do every year, has worked with, it worked with the City of Whitehorse, but this year we've worked with the Chief Medical Officer of Health to determine appropriate guidelines for the joint use agreements, which is the document and the rules for how those spaces are used outside of school hours. That work was done some time ago, and an agreement was reached about how we could safely use those spaces. That information was communicated to the City of Whitehorse, and the City of Whitehorse is responsible for the scheduling of those user groups in schools after school hours. And I understand that they are working on that schedule, and then we'll be announcing to the user groups how that will be set out for the next number of months. I can say that with respect to the work that our department did with Community Services and the Chief Medical Officer of Health, that the determination was that the spaces could be safely used by one type of user group per evening. So, for instance, soccer groups that might want to be using gymnasiums could use it on a particular evening, whatever evening that might be, but we wouldn't be switching from the use of a soccer group and then onto a badminton group or into a dance or a yoga group or something like that because of the necessity to clean and sanitize the space in between. But we have communicated that to user groups, and City of Whitehorse is doing the scheduling as we speak, as far as I understand.
Thank you. Haley, do you have another question?
Yes, thank you. My second question, sort of related to Claudiane's question about student success. I wonder if there's been any change to the latitude that teachers have when it comes to marking and grading. I can imagine there's grade 12 students who are anxious about competing for spots post-secondary. How much flexibility do teachers have if they're seeing a difference between the way students were doing compared to last semester to this one?
Thanks for that question, Haley. I think it's important that we remember that learning and education is an individual pursuit. It always has been, it always will be. Students and adults learn in different ways. They learn at a different pace. That this is something that teachers have always had expertise in trying to help determine an individual student's abilities and skills and assessing them with respect to their curriculum. I should comment that the Yukon's curriculum and which has been redesigned and implemented in schools over the last 3 to 4 years is ideally suited for the kind of assessment you're asking about. It is about individual learning. It is about assessing students on their numeracy, their literacy, their skill sets, their critical thinking. Those kinds of things are much more the future of education and have been implemented here in the Yukon Territory to the benefit of students. Gone are the days when students students were required to memorize certain things and regurgitate them either on tests or in some sort of assessment. It's really about determining how students are being assessed and achieving these competencies, which will lead them into their future.
Thank you. We'll move now to Gabrielle, Whitehorse Star.
Hi, I'm going to repeat the question. I know that we've done this almost every week, but I know a lot of people are looking at the numbers from BC and are wondering why not just close the border? Why not require self-isolation again? So, Dr. Hanley, maybe you could speak to that again.
Yeah, sure. I'm happy to speak to that, and of course, that's a question that we come back to all the time as well, because it's a very important question. And again, the overall goal is to for us, our pandemic response goal really is to be to achieve that protection against COVID, and to minimize the transmission and the potential serious impacts of COVID, while minimizing societal disruption. And that minimizing societal disruption is an equally important goal. So that's why we're always trying to look and relook and examine that right balance. So having that open door in a way with BC is one of those ways to redress that balance and to maintain and promote societal functioning by having that stimulus to economic activity, by having the ability to visit and travel, by having easier flow of goods, by supporting aviation. I mean, there are so many factors that are part of that package of having that open border with BC, but at the same time, we maintain self-isolation to other areas as kind of that, again, of taking on that reasonable protection versus reasonable openness. So in light of the increasing activity, it certainly does theoretically increase the risk of COVID introduction into Yukon. But we also know that that introduction risk is mitigated or reduced by the overall reduction in travel. So there is not as much travel as there was in the summer, probably about half as much. So again, there's a kind of a natural mitigation of that introduction risk. And as I said, we are and will always deal with introduction risk. There is always the risk of cases coming in, people with COVID coming into territory, and that's okay. It's what we do with that risk to minimize minimize the risk of one case becoming an outbreak, which is why we continually refocus. So when we look at the equation, yes, we are looking at an increased number of active cases, and potentially we will see that number continue to escalate. We're all hoping, along with BC residents, that these measures aimed at the Lower Mainland will help to bend that curve and to get things back under control. But we are watching. But the other important thing is that BC is still in quite a different place from other jurisdictions. The BC cases are still, the majority of cases are linked to known cases and outbreaks. And so we have confidence in their public health capacity. And at the same time, on the flip side, we continue to have confidence in our own public health capacity. We have only the one active case. We have good surge capacity in our public health ability to contact trace. We have good testing capacity, and we continue to maintain that good testing capacity. And we continue to have that acute healthcare surge capacity. So we are, and the other factor is, again, knowing that there has been this risk of introduction from BC, we have not had any cases that can be attributed to the BC bubble arrangement. So all to say that we're still doing okay, and we still continue to closely monitor, and it comes back to individuals to do the right thing.
Thank you. A follow-up question, Gabrielle?
I was hoping you could elaborate for a moment on how that risk is assessed when reevaluating the open border with BC. It sounds like we're not seeing a lot of BC residents come up to the Yukon at all at this point in the season, and is that part of that risk assessment?
Yeah, we do actually monitor through, because we have border controls. We monitor who comes in by air and by land. So we actually look at those numbers. We have roughly 200 people coming in from BC a day at the moment. I believe the numbers are around 200, and about half of those are Yukon residents, and and the rest are split between BC residents and those coming through BC, but who are from other jurisdictions and who would be under self-isolation orders. So there is a mix. A large proportion is Yukoners who are going to BC and coming back again. Again, that places an onus on Yukon individuals to do the right thing. So we look at those numbers, and we also look at active case numbers, and then do calculations of risk of any risk of people coming across with COVID, based on those those calculations.
Thank you. We'll move now to Marine Roboreal.
Oui, bonjour. C'est une question pour le Dr Hanley. Est-ce que vous m'entendez?
Oui.
Est-ce que vous m'entendez?
Oui, on vous entend.
Parfait, merci. Donc, nous voyons déjà qu'il y a beaucoup de masques à usage unique dans les rues, dans les parcs et surtout proches des écoles. L'annonce que vous avez faite aujourd'hui mentionne que les masques vont devenir obligatoires dans les lieux communs des écoles. Donc, j'ai deux questions à ce sujet. La première question, pensez-vous que ce genre de déchets qui se présentent aux abords des écoles puisse présenter un danger sanitaire pour les élèves, les masques à usage unique qui traînent un peu partout?
So the question is for Dr. Hanley. We see a lot of single-use masks on the ground around schools and in many places in town. Do you think that this, and now you're saying that more of these masks will be used, do you think that these masks lying around pose a health threat to the population?
Merci. C'est un problème de voir les déchets, les masques un peu partout, et on a des soucis que ça peut accumuler. J'encourage, et avec les nouveaux recommandations et les nouveaux conseils pour les masques, on espère qu'on peut travailler avec le département et avec la population de bien garder les masques, d'utiliser les masques réutilisables, et de minimiser l'usage de masques, les masques pour une utilisation seulement. Donc peut-être on va être plus sage à gérer l'usage des masques, et peut-être c'est une formation pour nous tous. Par rapport à la risque, on peut toujours pas dire que ça pose pas un risque. C'est mieux de pas toucher les masques qui sont dans la rue. Ça pose probablement un risque très minimal, mais on sait jamais si il y a toujours une possibilité qu'un masque peut être contaminé. Donc, on est conseillé pour les enfants de ne pas toucher des masques, mais à part de ça, ça pose pas un risque juste pour être jeté par terre. I'm asked to translate that into English. The question is about mask. If we are moving to a school requirement, will we see more masks being thrown away and lying around? And I agree that's an environmental problem. It's a problem we need to address as a population and to be better informed and cultivate that habit of properly disposing of disposable masks. Also, I encourage the use where non-medical masks are required to use reusable masks as much as possible, and that single-use masks should be minimized outside of the healthcare setting where they are necessary. And the question was, do these masks pose a risk, if they're lying around? And of course, we never know for sure if a mask might be contaminated. It's not, in general, it's not a good thing to touch someone's used mask. So it's not a good idea just for a kid to touch a mask that's used by someone else. But leave it to proper waste disposal with people who are trained or supervising the area to be able to pick up masks with proper adherence to sanitation protocols.
Thank you. Avez-vous une autre question, Marine?
Oui, merci. Au début de l'année scolaire, Dr. Hanley, vous aviez annoncé que des masques réutilisables seraient fournis aux élèves, que certains avaient même été déjà commandés. Où en est-on par rapport à ça, ou est-ce que c'est devenu la responsabilité de chaque école de pouvoir fournir des masques réutilisables à leurs élèves?
Beginning of the school year, you said that reusable masks would be made available to students in school. Where are we on this possibility? Is it the responsibility of the parents, or is the school system going to do something about this?
For the question, I understand that those reusable masks are being made available in schools. It is an operational part of the school plan, and I will find out more details about how those are being used at individual schools or with the sanction of school councils. I know there are some cases where school councils have purchased reusable masks, or with the assistance of parents and others, shields for certain grades. It is an individual classroom situation. Certainly we encourage students to come with a reusable mask that they've been supplied with by their family, by their parents, and but we certainly will be and are supporting reusable masks in schools across the territory. And I just don't have much up-to-date information or detail on that, but I can obtain it.
Thank you very much. I'd like to thank everyone for their time today. Please note that we're changing the day and time of our COVID-19 updates beginning next week. COVID-19 updates will take place on Tuesdays at 9:30, which means the next COVID-19 update is Tuesday, November 17th at 9:30 a.m.